Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, today we'll be discussing a very important topic in clinical pathology. That is, this is in like day-to-day practice for the IVF specialists also, the examination. Because nowadays the trend is a lot for the infertility couple. The topic of infertility is like a hue and cry because of many reasons, which is rampant in our current society, the norms, the people they follow. So this semen analysis, that is a very important part of investigation. And what we'll be highlighting we'll be discussing in today's lecture is the updated WHO 6th edition. What are the changes that have been given? This WHO 6th edition has been given in 2021. So we'll be before 2021, it was edited in 2010. So we'll be discussing the points which have been incorporated in the 6th edition of WHO. And at the end, I'll be giving you in detail like how the current semen analysis report should be given out. So let's go ahead with it. So infertility, as I said you, what is it? It's basically inability to achieve spontaneous pregnancy within 1 year of regular unprotected sexual intercourse. So this is the definition which is for infertility. So now it is estimated that between 48 million couples and 186 million individuals globally. So this is the data which is prevailing. So 48 million couples are affected by this and 186 million individuals are infertile. So infertility affects 1 in 8 couple of reproductive age group. So with male factor, it is solely responsible in 20% of case, and in contribution along with the female factor, it is contributory in 30% of case. So in total, you can estimate that 50% cases, this semen analysis is so important to be done. So semen analysis, it forms a cornerstone for male fertility evaluation. So WHO manual जो होती है, that we follow, it is an established as an important document होता है, that is to standardize the procedure for examination of human semen. So over past 4 decades, last 40 years से WHO change कर रही है, and this the 6th edition which was given in 2021 is the current WHO manual which has been produced. So most recent one which you will follow is 6th edition given in 2021. So it provides critical information on your semen examination, then how sperm preparation is done, what are various cryopreservation techniques, what are quality control and assurance. So all these are given in detail in the WHO manual. So in 6th edition of WHO manual, the semen analysis के investigations हैं, that has been divided into your 3 basic categories. Like there are certain basic examination, then you have extended examination, then you have advanced examination. So basic, extended and advanced. So different tests are under these headings. So basic examination will deal with your routine examination that both clinician and lab can follow to determine the semen variables. Now extended, what it will have certain tests which are required in certain conditions after the clinicians order it. And then advanced examination, it is not currently in the routine practice for infertility. It is more of a research based investigation. So how semen collection is done? It is by your masturbation process, and abstinence, sexual abstinence should be for 2 to 7 days. And semen should be fully collected and lab assessment should be done within 30 to 60 minutes of semen collection. So to ensure the quality, so suppose the sample has to come to lab from a certain distance. So the temperature has to be maintained around 20 to 27 degrees Celsius, and the patient should be informed the correct requirement of semen collection to ensure accurate evaluation of semen and interpretation of the results. So you should explain the patient properly the technique, how to collect, after how much period of abstinence it should be collected, then how fast you have to bring the sample to the lab and how fast it has to be reported. So all this has to be documented properly. Only then you will get a correct interpretation of the semen. So basic examination जो हमने first heading पढ़ी है, so what it has. So sixth edition ने क्या add किया है कि information of a strong order of the urine or putrefaction can be a clinical importance. So you have to note that as in report. But that assessment of semen order can be very subjective, correct? So it is not consistent with the recommendation of your safety of lab personnel against emerging virus. So there are, see, whenever some changes or addition are being made to some standardized protocol, there can be some kind of variation which needs to be validated over the course of time. So, sir, if this point cannot be accepted, so in maybe in seventh edition, this point will be deleted also. So we don't know, but what is given is that we have to know about, at least we should be thorough about what has been given. So sixth edition में the order has to be mentioned. So in sixth edition the classification of sperm motility is reverted to your previous fifth edition जो पहले से था. Like by distinguishing your progressive motile sperm into rapid and rapidly progressive and slowly progressive. So the rationale for this change is that presence of rapidly progressive motile sperm can affect the outcome of the fertility. Like rapidly progressive, so it will comply with more fertile, more fertility. Then the basic examination also give you correct, accurate assessment of sperm in low concentration and emphasize the importance of total sperm. So total sperm concentration है uske along with that you give total sperm per ejaculate also in diagnosis rather than mere sperm concentration. So दो heading में आएगी report, एक होगा total sperm concentration, एक होता है total sperm numbers per ejaculate. So, and this also, additionally, the sixth edition gives you total sperm motility below 40% अगर होती है motility. So, indication for sperm vitality assessment. So, अगर total, when you assess the motility, कि आपकी progressive motile जो है वो 40% ही है. ठीक है, तो उसके बाद अगर less than 40% आ रहे हैं, तो we have to advise the patient for your sperm vitality tests. So semen sperm vitality staining, it is an adjunctive test. कैसे करते हैं हम sperm vitality को? If the semen sample show reduced motility, since distinguishes you live immotile and dead immotile. So it can be, it is very important, like the couple who are going for intracytoplasmic sperm injection. So उसमें rapidly progressive, the progressive amount of the progressive sperm should be more. However, there are no change in sperm morphology, assessment or interpretation in your sixth edition. It all same. So now in a fifth edition, the assessment of leukocyte in semen and anti-sperm body. This was a standard test of semen is now moved to extended examination. पहले fifth edition में ना ये routine में आता था, basic investigation में आता था assessment of leukocyte in sperms and anti-sperm antibodies. But now they have moved these tests to extended, the second category. So therefore clinician, second category की जो tests होते हैं, extended test, वो clinician आपसे demand करते हैं कि we need these kind of tests, only then you will do it, will not do it routinely, correct? So therefore clinician should ask the lab for these tests whenever they need it. So the clinician can order leukocyte assessment in semen, अगर उनको कोई accessory gland infection लग रहा है patient में, so they can then order it, correct? So now coming to our second one, that is extended examination. Extended examination means there are addition of your sperm genetics, including your chromosomal abnormalities detection, gene mutations, chromatin evaluation, sperm DNA, fragmentation, the sperm DNA fragmentation, SDF कहते हैं उसको. Testing aside from that, like leukocyte जो हमने भी discuss किया, leukocyte, antibodies, immature germ cells, indices, multiple sperm defects, and biochemical assessment of accessory organ function. So genetic and chromatin assessment जो होता है, so these are the tests which are added. So additionally, the manual acknowledged that जो sperm DNA fragmentation होता है, it's one of the most critical addition to male infertility evaluation. Now it is the most promising topic discussed in andrology. Okay. Now third is your advanced. So extended जो basic हम routinely process करते हैं. Then extended is like a clinician the demand and then you give these tests. And third is your advanced test, advanced examination. So this is mainly research based or using as an emerging technology. So the main objective of advanced examination is to understand the sperm quality and function deeply at the cellular and molecular level. So not routinely done. इसमें कौन-कौन से tests आते हैं? Just for the namesake also you can remember seminal oxidative stress, chromatin integrity, acrosome reactions, computer assisted semen analysis. So there are certain terms which have been a nomenclature which is given in WHO, like your azoospermia is complete absence or lack of spermatozoa in the semen ejaculate. Oligozoospermia is sperm count less than 15 million per ml. Teratozoospermia is having less than 4% of sperm with normal morphology. Then you have asthenoteratozoospermia, that is having a count of total motile sperm less than 42 or progressive motile sperm less than 30. Then you have oligoasthenoteratozoospermia, that is less than 15 million sperm per ml, less than 42% motility, less than 4% of normal morphology, OAT. Then you have oligoasthenozoospermia, having less than 4% normal morphology of sperm and less than 15 million sperm per ml. Then oligoteratozoospermia, having less than 4% of normal morphology, less than 15 million sperm per ml. Asthenoteratozoospermia, less than 42% of all motile sperm and less than 4% of sperm with normal morphology. The normozoospermia is a normal one, correct? Having semen parameters more than 15 million per sperm per ml, that is a normal criteria for your fertility, WHO criteria. Then more than 40% overall motility and more than 4% of normal morphology. Then you have severe OAT, that is total number of sperms less than 5 million sperm per ml. This is severe OAT, severe oligoasthenoteratozoospermia with less than 4% morphology, less than 32% progressive motility. Then you have severe oligoteratozoospermia, means total number of sperm is less than 5 million per ml. So all these terms are described very well in WHO 2021 manual. So this is the table which compares your 5th and 6th edition. So sample collection के standard procedures थे, उनको थोड़ा बहुत update किया गया. It's a very big, like chapters है, pages है. So we need to go thoroughly which what are the sample collection procedures which have been changed. Then initial examination था, basic macroscopy करते थे, अब हम detailed macroscopy and investigation करते हैं. Sperm motility के लिए basic करते थे assessment. Now we detail motility with vitality check also. When we do the vitality check, when the motile sperms are less than 40%. Then we go for vitality tests. Then sperm count is included with more precision because now we're giving total sperm per ejaculate also. So the non-sperm cells also basically count with the advanced counting method. The other cells that also will count. Then biochemical analysis was limited. So now we have comprehensive accessory sex organ evaluation also. Now coming to the value. So values जो थे semen volume पहले 1.5 था. Now it is 1.4 volume total. So see, certain changes are very minute. So let's see whether it will be acceptable in the 7th edition or not. So these are very minute changes. You can see also somewhere the thresholds हैं वो change किए गए हैं. The range, the lower range. Let's say 1.4 to 1.7 था. It has been decreased to 1.3 to 1.5. The total sperm number 39 million, so that average is okay, but the threshold has been increased. The 33 to 46 tha, it is 35 to 40. So threshold, low and high threshold have been changed. So that you have to keep in mind for the values. Total motility was 40, now it is like 42%, but 40 to 43 range change ho jati hai. Progressive motility 30, non-progressive 1 to 1, then immotile sperm 20. Range also you need to remember, vitality like 54, 50 to 56 is the range. Normal form C, this is very important. Every time we did not give normal form 70% seen in the semen examination. WHO के according अगर आप 4% भी normal morphology देते हो, that is an adequate criteria for the couple to be fertile, correct? So these changes which have been made, जो अभी मैं discuss किया, terms में देखो जो हम basic, extended और advanced जो अभी मैं आपको बता रही थी. So this is the new terms. Previously basic was known as standard, extended was known as optional and advanced was known as research. तो इसको अब current हम जो use कर रहे हैं वो है basic, extended and advanced. So basic examination में addition of semen order का किया था, which is not actually, let's see whether it's subjective, how we proceed with it. Then progressive sperm motility into rapid and slow categorize करते हैं. Systematic approach to morphology assessment. Vitality अगर check करते हैं, if motility is less than 40%, then these all few terms have been removed from the basic examination. Then extended is important is leukocyte and antibodies. जो अगर clinician आपको order मतलब they request you for these tests. Then additional tests like discussion on your sperm DNA damage, SDF, that is sperm DNA fragmentation tests are also done. Advanced is basically for your research. So अभी उतना नहीं होता है. So the key point is that the 6th edition जो होता है WHO का, it allows you to go for a robust evaluation and processing of human semen, and it's a good guideline book which a laboratory personnel can use. The 6th edition is composed of several chapters including your basic, extended and advanced It's related to your sperm, semen, and cryopreservation. Quality control is to be maintained. Then indicate the fifth centile value, जो basic semen के parameters हैं वो change हुए हैं. Sometimes the lower and the high upper threshold has been changed. When abnormal semens are detected, the patient should be referred to a male reproductive specialist for a comprehensive clinical evaluation. So now coming to the proper semen analysis, how we do it in our lab. So collection में क्या है? The semen sample should be collected after minimum of 48 hours, no longer than 7 days of abstinence. So abstinence should be 2 to 7 days, not less than 2 days, not more than 7 days. So patient information, how you have to, the moment you receive sample, you have to record patient information, ask the detailed history about period of abstinence, date and time of collection, date to be recorded. When you are examining, that time should be recorded. The two sample ideally should be collected for initial evaluation, and interval between the two samples should not be less than 7 days or more than 3 months apart. आज आपने sample collect किया, if you want a second sample, collect it not less than after 7 days or less than 3 months. So patient should be instructed to bladder evacuation, properly pass the urine and then collect the sample, and it can be obtained by masturbation and ejaculated in a clean, wide-mouthed, sterile plastic container, and no condom should be used for semen collection, because what happens, the chemicals or the anything which is there in the condom, that will interfere with the viability of the spermatozoa. Then agar immediately the sample cannot reach the lab, so there has to you have to ask the patient to follow the transport, storage and stability rules. So ideally the semen should be allowed to be collected in lab only, and if transported, sample should be kept at 37 degree during the transport, should be brought within 1 hour of collection, and after जैसे आप sample आया, allow it to liquefy, and it usually liquefies between 30 minutes to 60 minutes, and then you can examine the sample. Then there are rejection criteria. Every sample cannot be taken for reporting. So what are the criteria to reject the sample? So sample more than 2 hour old should be rejected. Wrongly labeled sample always to be rejected. Period of abstinence, if it is less than 2 or more than 7, that sample also to be. And what all instruments you require? हमें चाहिए क्या क्या? Semen diluting fluid, Nemo's chamber, glass slide, cover slip, pap stain to see the morphology, micropipettes, glass tube, timer, pipette, tissue paper, gloves, microscope, red bag disposal for the disposal of the products. Then quality control. For physical and microscopic examination, we can give split sample testing every 6 months and record. We can maintain our internal quality control files. So after liquefy, जो 30 to 60 minutes में हो चुका है liquefy, two major component you have to examine. You have to look for the gross macroscopic features and you have to look for your microscopic feature. So macroscopy में हम क्या देखते हैं? We check the specimen for volume, color, viscosity, liquefaction time and pH. So volume आप कैसे weigh करोगे? जब आप patient को आप collection के लिए empty container देते हो, weight when the sample brings the semen, then again you weigh it. So minus, that is the volume of your semen. Or you can use a graduated cylinder also, so that gives you accurate value of the volume. Then color, it is mostly whitish in color. And viscosity कैसे देखते हो? Pouring semen by drop. अगर the thread is of more than 2, when you drop a semen, अगर एक drop गिराते हो आप, तो if the thread is of less than 2 centimeter, it is okay, viscosity is normal. And if it is falling like a drop, and if it is forming a thread while falling from the dropper, it is more than 2 centimeter. अगर है वो thread, that is abnormally abnormal in consistency. So then liquefaction time, so it is highly viscid है, so एक coagulum बन जाता है semen का, but it liquefies to form a translucent turbid viscous fluid if we allow it to maintain the temp, like 30 to 60 degrees, 30 to 60 minutes में it becomes a liquid like. Then pH also, normal pH strip के through you can measure the pH of the semen. Then microscopy में three important things you need to see: motility, morphology and sperm. So motility is like you can put fixed 10 microliter amount of semen in a clean glass slide, cover it 22 by 22 millimeter cover slip and allow it to settle, and then examine under 400x. So what will you examine? A is your rapidly progressive semen sperms, B is your slowly sluggish progressive sperms, C is non-progressive and D is immotile. Then motility we can grade है, like it display rapidly progressive motility along a linear track. Then grade B is the sperms move slowly and with substantial yaw. Slowly it is moving. Then grade C is your sperms have no forward progression. 0 is absence of motility, pure dead sperms. So at least you need to examine 100 spermatozoa for motility. Then coming to your morphology. Morphology के लिए you need to have fixed smear. So pap stain करते हैं, alcohol fixed samples में, smears में, then we need to see 200 sperm under oil immersion and record the percentage. So आप क्या देखते हो, एक तो आप first आप other cells भी देखते हो आप spermatozoa में, जैसे WBC, spermatogonic cells which are round, so that all should not be counted. Agglutination क्या होता है, motile sperm जो होते हैं they stick to each other in orientation, like they will चिपक जाते हैं head to head, mid piece to mid piece और mid mixed ways. So this is the normal sperm, you can see how it is. So ये एक normal sperm है, ठीक है, ये उसका head होता है, head में होता है acrosomal cap, then you have a neck, then you have this mid piece, correct, and then you have a long tail. So this is how head, neck and tail of the sperm is described. Then head defects क्या देख रहे हो आप, ये globular है, bifid है, all different in shape. This is round, this is pure shape, this is moth eaten like, so this is diamond जैसा हो गया, some dumbbell जैसा. So all these are defects. Mid piece में देखो, mid piece में जो neck का area है, it is थोड़ा bulbous, it is punched out, so it is thin, it is bulbous from one end, it is bulbous from two end. Then you have tail defects. Two tails are there in the sperm, short tail, curved tail, twisted tail. So all these defects should be noted. Then how you do it? The sperm concentration कैसे देखते हैं? We do use using hemocytometer. 50 microliter of liquefied semen is taken. 950 microliter of semen diluting fluid is added to it. To prepare 1:20 dilution of the sample, you have to fill the hemocytometer with diluted sample. Correct? And then you have to leave the chamber kept in covered petri dish for allow it to settle for 2 minutes, and then count the sperms in four corners. And WC counting chambers होते हैं न्यूबर्स चैम्बर में, उसी में हमें काउंट करना होता है इससे, करेक्ट. Then count the sperm with complete head and tail we need to evaluate. So sperm concentration, the total sperm per ejaculate is the number of millions of sperm in entire ejaculate. So it's calculated by multiplying the sperm concentration by ejaculate volume, which is double, almost double हो जाता है. तो biological reference क्या होता है, WHO parameter के, volume is 2 ml or more, pH 7.228, concentration 15 million or more, you can say 50% or more with forward progression, 25% more with rapid progression, morphology 30% of more within normal. This is the reference I'm saying. But the ideal criteria जो values है, we have discussed it before. So normal result आप interpret करते हो, normal जो होता है semen, that is whitish and grey opalescent, clear sperm concent. अगर color wise clear आ रहा है, it is concentration is low. If it is a yellow hue to the sperm semen, it is pyospermia. If it is rust brown in color, means some bleeding has been going on, hematospermia हो चुका है. वॉल्यूम अगर नॉर्मल 2 ml 1.5 to 2 ml इट्स नॉर्मल. लो वॉल्यूम कब आती है, जब कोई एक्सेसरी सेक्स ग्लैंड सिंथेसिस में डिस्कवर प्रॉब्लम आ रही है, और सिक्रीशन ऑफ फिजिकल ऑब्स्ट्रक्शन हो रहा है इन द रिप्रोडक्टिव ट्रैक, और देयर इज इनकम्प्लीट और retrograde ejaculation. Large volume when you get it, when it is associated with varicocele or after relatively long period of sexual abstinence. Then pH 7.2 to 8. Then you have increased acute infection in prostate or seminal vesicle or epididymis. Then pH will be increased. pH will be decreased when there is obstruction to the ejaculatory duct or contamination with the. Then liquefaction time 30 to 60 minutes. Increase कब हो जाती है? When there are functional disturbances of prostate. Consistency, it is normal, abnormal. Normal consistency, I told you, if it dropped by the dropper, it is less than 2 centimeter of thread. If it is being formed, it is normal. अगर abnormal हम कब बोलते हैं consistency? When the thread of the drop of the semen which is forming if it is more than 2 centimeter का thread अगर बन रहा है, it means that it's having some prostate dysfunction due to chronic inflammation. So how the format, final report when you see for the semen analysis, check for the physical examination में क्या क्या reports आपको check करनी है, points, time mentioned है of the specimen collection, time of examination, duration of abstinence, liquefaction at 37 degrees Celsius, volume, color, viscosity, pH. All these points should be mentioned in your report. Microscopic examination में when you need to see it, total sperm concentration, क्या क्या देखना है आपको, points check करने हैं, then sperm concentrate per ejaculate, percentage motility कितनी है total, progressive motile, slowly progressive and immotile, agglutination present or not, vitality you have to check, pus cells, RBC, epithelial cells, all these you can put down on morphology, the microscopy. Then additionally in morphology what you need to see, normal कितने हैं sperm और abnormal कितने हैं. फिर abnormal में you have to categorize which type of defect it is, head defect, neck and midpiece defect or tail defects. So I had shown you the diagram. Then chemical examination, semen fructose if done. It is, if available, that is also done. So these are few of my references. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Looking forward. Thank you so much.